Bismillahirrahmanirrahim. This video is about general physical examination. In fact, the general physical examination is the detailed evaluation of an overall health of a patient for any possible medical signs of a specific medical condition. Prior to the examination, we need a warm and private environment. Check the patient's ID. Consider the need for a chaperone. Wash your hands, preferably ensuring they are warm. Introduce yourself. Ask permission to examine the patient. And also ask, are they comfortable lying flat or not? Also tell what status you hold. Explain why you need to examine the patient. Gain verbal consent. Start examination by looking at the general appearance of the patient, body posture and mobility, hygiene, and also look for any sign of distress. Give thermometer to the patient to put it under her armpit. Examine the hands for pallor. There are several causes of pallor. They range from emotional distress to an underlying condition like anemia. But the main cause of pallor is the deficiency of hemoglobin that can produce pallor of the skin. The sites for looking for the pallor include palpebral conjunctiva and buccal mucosa along with the hands. So, pallor should be noticeable especially in the palmar creases if the anemia is severe, means the HB is less than 8 gram per liter. Also examine the hands for cyanosis. Cyanosis is the bluish discoloration of the skin. Some causes include Raynaud disease, cardiovascular problems, and hypothermia. Here we have the central and peripheral causes of cyanosis. The central causes include decreased arterial oxygen saturation, like in case of the high altitude, the lung disease, and right to left cardiac shunt. Other causes include polycythemia and hemoglobin abnormalities. Peripheral cyanosis occurs in all causes of the central cyanosis and also when there is exposure to cold, when there is reduced cardiac output like left ventricular failure or shock, or when we have arterial or venous obstruction. Also examine the hands for other features like acromegaly. In fact, acromegaly causes thickening of the soft part of the fingers due to direct hormonal effect together with the enlargement of sesamoid bones, phalanges, and metacarpals, mainly of the terminal tufts of the distal phalanges resulting from excessive periosteal bone formation. Also examine the nails. And this is the table showing different characteristic features of the nails indicating different abnormalities, like we may have the blue nails, the red nails, the yellow nails, we may have the splinter hemorrhages on the nails, chylonychia, onycholysis, leuconychia, nail fold erythema, and Terry's nail. After examining the hands, check the pulse for complete 1 minute. Check the blood pressure of the patient as well. Do appropriate thyroid examination by inspection and palpation. Examine the conjunctiva for pallor. Examine the sclera for jaundice. Also examine the eyes for exophthalmos, which is the protrusion of one or both eyes anteriorly. It commonly manifests in thyroid-associated eye disease such as Graves' disease ophthalmopathy. Another important facial feature is acromegaly, which causes gradual changes in the facial features, like there is protrusion of the lower jaw and the brow bone, an enlarged nose, thickened lip, and the wide spacing between the teeth. The distinctive features of the Down syndrome include slanting eyes, small chin, round face, and the flat nasal bridge, etc. In Cushing syndrome, patient presents with round moon faces. Here we can see the facial puffiness of the patient, and the causes include hypothyroidism, Cushing syndrome, cellulitis, sinusitis, or allergy, etc. Examine the mouth for orodental hygiene or for any ulcers. Here you can see the Beckett ulcer. Also look for gum hypertrophy if present. Also note down the pigmentation of the mouth. You may come across the angular stomatitis. Next come the neck examination for lymphadenopathy. Here you can see a very prominent cervical lymphadenopathy. So now you have given enough time for temperature recording. So take thermometer back from the patient and note down the temperature. After that, examine the legs for pedal edema. Now, Check the respiratory rate by looking at the movements of the abdomen of the patient for 15 seconds and multiply it by 4. Also check whether it is normal or paradox. So here we have the normal respiratory rates at the different age groups. So thank you so much. That was all about the general physical examination. Subscribe on Obs and Gynae. Allah Hafiz.